Nigerians will have a new electoral act that they desire ahead of the 2027 general election. Joke Adisa, TVC News, Abuja.
A bit of health now. The Minister of State for Health, Dr. Tunji Alausa, will today inaugurate the National Council on Health Research at the National Institute of Health Research here in Lagos. This council has a multi-dimensional role to play in ensuring the safety of lives in Nigeria. Health correspondent Jacqueline Ogo is standing by at the venue. Jacqueline, what more are you learning about this development?
Yes, thank you very much. The Minister of State for Health, Dr. Tunji Alausa, is just about to inaugurate this very crucial council that the nation needs at this very time. You know, researchers are actually whistleblowers. They let the nation know how deadly a disease will turn out to be. Let me quickly use the case of COVID-19. When COVID-19 came on, everyone needed to know, safety measures. And so the researchers were the ones that were able to tell nations that the virus was mutating and bringing out various variants. And, when new variants come in, one may be attacking the lungs, another the liver, the kidney, just like that. So if the researchers, keep you on how to hold on so that you don't become a victim of a mutating virus, then we're talking about life safety here. So research is very crucial to national development. And another thing also crucial to research itself is funding. So setting up this council is not just enough. Funding the council to make sure that it has the graded equipment that it needs for various categories of research is also important. Like you'll hear the NAFDAC DG say to you that we have a category 1 laboratory, a category 2, 3, and all of the categories that have to be there for proper research to be done. It means that the nation has to power up to get to the levels that are acceptable internationally to tackle a particular disease on the prowl. So that is why this council is very, very crucial. And I also want to tell you this. It is a collaboration with international researchers to form one bunch, and this bunch is to be able to make concrete impact on the nation's health sector to ensure that lives are not wasted by diseases that can be curtailed. And another side to it again is that we have young researchers. These young researchers, I've talked to some of them in time past, and they will say they don't really want to be in Nigeria because they would not have the needed equipment to work with. So this is a time where the federal government will have to look at making sure that the national budget does not just sideline research. Research needs a lot of money to be effective. Yes. So that would mean that if we have all that we need, the laboratories, the standard laboratories, the young researchers will stay and the old researchers will be able to impact on more and more. Even from the school level. You look at some of the schools in Nigeria, they have what they call laboratories. But by all the standards of what a laboratory should be, they are not like that. So this is a time when the government should really sit down, because the experts are going to be here, part of this council that is just about to be inaugurated. So they will want serious business if we say we want serious business too. And another thing I want to quickly mention here is that research is a money spinner. When we get serious with research in Nigeria, I tell you, many nations will come into our country to come and know how we do it. And in the process, there will be movements. If we also have the right equipment, people will buy from us. So research is a big one for our nation. And I think that for the government to make
we're looking forward to
put up a council
what the blueprint will be and the direction of the inauguration of this council. Senior correspondent Jacqueline Ogo live for us at the venue of the inauguration of the National Council